Well, thank you and good afternoon. Today I'm pleased to share with you some details on Bill 65, the Health Statutes Amendment Act, Spring 2021, which I will be tabling in the legislature later on this afternoon. And this bill proposes amendments to, first, the Health Professions Act, the Pharmacy and Drug Act, the Alberta Evidence Act, and as well the Crown's Right of Recovery Act. And there are also some minor housekeeping amendments to the Mental Health Act, as well as the Health Facilities Act. And these proposed amendments continue government's work to update and to strengthen our province's health legislation. The proposed changes would help make Alberta's health system serve Albertans better by supporting more transparency and continuous improvement. The proposed amendments also focus on areas that would increase system efficiencies, ensure the health system can better adapt and respond to changing needs throughout the province, and as well continue to use public dollars wisely. And I'd like to provide you with an overview of the amendments proposed for each of these acts. First, for the Health Professions Act and the Pharmacy and Drug Act, there are changes for the pharmacy profession and pharmacy system. These amendments were initiated by the Alberta College of Pharmacy with a view to providing Albertans with an enhanced pharmacy system, a system that is more accountable and more modern and continues to operate safely. The proposed amendments would increase pharmacy owner compliance with legislative, regulatory, and licensing requirements while being more responsive to changing patient needs. The amendments would ensure that pharmacy owners, regardless of the ownership model, are more accountable for the care that they provide. And the proposed amendments would also add references to pharmacy technicians working in the pharmacy system to ensure their accountability to Albertans. On top of this, the proposed amendments would enable pharmacists as well as pharmacy technicians to continue to provide services for animal health, providing Albertans who raise or own animals with more options for services for these animals. And these services were previously authorized in legislation. However, when governance of the profession was transferred from the Pharmaceutical Profession Act to the Health Professions Act, this legal authorization was not included. We also need to ensure that pharmacists have explicit authority to provide pharmacy services for animals because of changes made to the Food and Drug Act, which is federal legislation. The changes to the Health Professions Act will clarify that it is still intended for pharmacists as well as pharmacy technicians to provide pharmacy services to support animal health and provide them with the legal authority for them to do so. And this is just the first step, as amendments to the related pharmacists and pharmacy technicians profession regulation would still be required to identify the specific types of pharmacy services that could be provided for animals. Bill 65 also provides or proposes amendments to the Alberta Evidence Act to ensure that judges who hold fatality inquiries throughout the province have the appropriate facts and the appropriate information from what is known as quality assurance committees. Now, right now, these quality assurance committees hold reviews of adverse events or unexpected deaths in healthcare settings, and they make recommendations to prevent similar events or similar deaths from happening again in our healthcare system. And these committees and their reviews are internal and don't assign blame to anybody, but they do look for the root causes of an error, which are usually the result of multiple contributing factors. The internal discussions are protected from being used as evidence in legal proceedings to ensure that physicians or nurses or other healthcare professionals and staff feel free to provide information about the incidents. And we support that and value the important work of the quality assurance committees. Until now in Alberta, no information from these reviews has ever been shared with judges who are overseeing public fatality inquiries. Our proposed amendments would mean that quality assurance committees would share facts and recommendations to help with public fatality inquiries. And this would only happen in the small number of cases where an internal review has been done prior to a fatality inquiry looking into the same unexpected death in the healthcare system. None of the information provided to provided to the fatality inquiries would identify individual health professionals. We don't want staff and we don't want colleagues to stop participating in these reviews for fear of repercussions. And these proposed changes are meant to ensure that judges at fatality inquiries have better access to information to support more comprehensive reviews, more comprehensive discussions, and more effective recommendations. And this should provide families comfort and reassurance that public fatality inquiries have the supporting information to help them conduct efficient reviews. We're also proposing amendments to the Crown's Right of Recovery Act. And this act provides government with the right to recover its costs of providing healthcare services to people who are injured due to someone else's negligence. The government sometimes joins lawsuits that are launched by an Albertan who is injured due to negligence to try to recover these costs. Now, in situations where the claimant loses the case, taxpayers are at risk of having to pay significant court and legal costs, even though the government's involvement in these situations and these lawsuits is typically minimal. Our proposed amendments would limit the cost exposure in these cases to a reasonable amount directly related to the government's right to recover healthcare costs. And this would ensure that Alberta taxpayers are not at risk of having to cover, I should say, the full costs associated with an injured person's unsuccessful lawsuit. Other provinces have taken a similar approach to protect their governments from this risk because it's the prudent thing to do. Proposed changes would also help to ease conflicts of interest that are faced by lawyers who represent both the province as well as the injured claimant, which have competing interests regarding the payment of costs if the court case is unsuccessful. Also, our proposed amendments would reduce red tape and administrative burden for auto insurers when faced with extraordinary circumstances, they struggle to file records on time or pay their portion of healthcare costs for people who are injured in collisions. Now, for example, natural disasters such as floods or fires can destroy insurance records. And in such circumstances, our amendments would authorize Treasury Board and Finance to waive penalties for an auto insurer who can't meet the deadlines to file a report. Other proposed amendments in this bill are to the Health Facilities Act and the Mental Health Act, as I said. These are largely housekeeping in nature to remove outdated references to repeal unproclaimed sections, for instance. Now, together, all of these proposed amendments continue government's work to strengthen and to modernize our health legislation here in the province. Taking these steps will provide Albertans with a more responsive health system that continues to operate in a safe and accountable fashion. Thank you very much for joining the press conference today. I'm happy to answer any questions.
So thanks. I know the Premier had an availability earlier, so we wanted to wait for him to finish up. So I'm sorry we started a bit late. I believe we've got two reporters on the line. We'll try to get to both of you. One question and one follow-up apiece, please. But we need to get back to the ledge, so we'll need to be done by about 1:20. So first caller, please.
Our first question comes from Lisa Johnson, Edmonton Journal.
Hi, good afternoon, Minister. My first question is regarding, I've been told a number of panels, reports, initiatives are on hold during COVID. So I guess I'm wondering, why is this bill being put forward now? It appears to be a lot of housekeeping, a lot of minor housekeeping, legislative housekeeping measures, particularly when, you promised a repeal of portions of Bill 10. So why now? Why is it necessary now?
Well, there is going to be other legislation in the spring sitting of this session, and so other legislation will be coming to the House when they've gone through the policy steps for them to first get to the House floor. These are, as you said, housekeeping items. This is good governance. This is us doing our due diligence. A number of these items are requests to government for many years. Some of them have been made to previous governments for over 10 years. So this is us continue to do the good work of listening to civil servants, continue to make sure that the healthcare system continues to be responsive to patient needs.
Thanks. Follow up, Lisa?
Yeah, this is sort of unrelated here, but I'm wondering in regards to the potential waiving of late filing fees for auto insurers. You've mentioned that these fees, in the event of a disaster, sometimes they will be late filing these reports, but do you have any idea how much these late fees, this potential savings would be for auto insurers? I didn't have the chance to ask this question this morning during the briefing.
Sure. No, and first of all, let me just clarify that what we're not waiving these fees. What the legislation right now says is that the late fees are mandatory for an insurer to pay. So all we're doing here is allowing the discretion to Treasury Board and Finance that for them to take a look at the situation at hand. If there's a legitimate reason for an insurer not being able to file those reports, then, for example, if there was a flood or if there was a fire, then they can take a look at that situation. They would have the discretion at that time. So there could still be late fees that are required for an insurer to pay, but at least Treasury Board of Finance would have that discretion going forward. And this would align us with other jurisdictions that also have that discretion and not, as it says now in the legislation, having it mandatory.
Thanks. Next caller, please.
Meredith Kerr, Lakeland Connect.
Hi, thank you. So the question that I had was to do more with the Crown's right to recovery portion of things. I was wondering about how the government decides whether they're going to be joining a lawsuit or not, since it appears now you're really trying to limit the exposure to legal costs that could end up being quite significant.
I'm sorry, Meredith, I may need you to reiterate the question, though. I understood that was about the Crown's Right to Recovery Act and the amendments, but what was the question, though?
So how is it that the government decides whether or not they're going to join somebody who's been injured in a lawsuit against the insurer or whoever it is that it's against?
Well, so a lot of situations, it might depend. And a lot of these situations might be a class action lawsuit, it might be a motor vehicle accident. And I don't, David, do you mind if I impose on you? This is David Skeen, who is the law director for the Ministry of Health. And David, the discretion to which there might exist for counsel to not include, I suppose, maybe if I could reiterate or change Meredith's question, what discretion do counsel have for a plaintiff?
So the obligation that's placed on counsel is to notify the Crown that this type of a lawsuit has been initiated seeking damages for personal injury. At that point, the Crown has the opportunity to join pursuant to the legislation. So it is a case-by-case determination, but it is a legal right for the Crown to seek those specific costs.
Thank you, David. Thanks, Meredith. Do you have a follow-up question, Meredith?
Yeah, so I mean, I understand that it's on a case-by-case basis, but I guess kind of what I'm trying to understand is how you determine that it's one that the government would participate in, and kind of what the actual cost savings to the government are expected to be, or what the potential cost to people who've been injured are going to be if they end up kind of getting saddled with the whole legal bill if the thing's not been successful.
Sure. So a couple of things. So right now, what the law says is that all of the parties to an action are jointly and severally responsible for the costs if the lawsuit is unsuccessful. Now, in most of this litigation, I think there are 3,000 or 4,000 files that are active right now. There are 3,000 active files that are right. But most of those lawsuits do not make it to the courthouse. And so for the small number of cases that make it to the courthouse where there's a decision by a judge or a justice that the lawsuit is unsuccessful, I think there was only 3 in the year 2020. So in those small number of cases where the judge has made that decision and the lawsuit is unsuccessful, right now there's a risk for the taxpayer if a plaintiff is not able to pay their portion of the costs. There is a risk to the taxpayer that they would have to be responsible for the full amount because we are a party and jointly and severally responsible. So right now that hasn't happened. But we want to align ourselves with other provinces and to do the right thing to limit the exposure of the Alberta taxpayer so that our risk of costs would be commensurate with our involvement in the lawsuit.
Thanks, Meredith. Sorry, the time's limited. Reminder, we're happy to follow up in writing if there are more questions that we can answer today. We'll take the next caller, please. I think we have time for 2.
Our next question comes from Bill Fortier, CTV News.
Hi, Minister. I'll try to be quick. Just looking at the numbers for long-term and assisted living outbreaks, we know that those places were hit the hardest by far when it came to fatalities over the course of this pandemic. A lot of operators are now reporting 0 active cases, and I'm just hoping you can comment on what a milestone that is in the overall battle to try to save lives here when we go from thousands of active cases down to pretty close to 0 at this point.
It's an enormous milestone that's heartwarming to see, and this is exactly what we've told Albertans for weeks, if not months, that this is now, the vaccines are not just the light at the end of the tunnel, but the end of the tunnel. And we do have a little bit more to go. If you were to add up all the vaccines that we've received as a province, since December, a third of those vaccines that we've received have just been in the last 5 days. So this is great that those vaccines that we got out the door in phase 1, it was a small number, unfortunately, in December and January. Thankfully, we were the first province to fully vaccinate everybody in long-term care and what we call in Alberta designated supportive living. And so it's great to see that that focus that we had on phase 1 has shown those results, Bill.
Okay. Thanks, Bill. Follow-up?
And just quick follow-up, yeah. The Premier's talked about how a diversity of voices is welcome, but once again, you have MLAs within the UCP, speaking out against these restrictions. Yourself and the Premier and health officials have said these are necessary, these new restrictions, to save lives and to protect people. How concerning is it to you as the health minister that your own MLAs don't understand that or don't agree with that? And how could that not sort of erode public confidence in government when its own members don't agree with health measures intended to save lives?
Well, I think Premier's spoken about this. Premier has talked it, I think previously today he spoke about it as well as yesterday in the House. So I'll leave it for Premier to speak about our caucus members. Look, for any Albertan who isn't taking the measures seriously, that is a concern for me. I think I would plead for all Albertans, regardless of their job, if they're in caucus or outside of caucus, to please, and I think earlier this week when I announced the tightening of health restrictions with Premier and Dr. Hinshaw, Premier made a plea that he understands that there's diversity of opinions, but please for these debates to happen based on the facts. And so I would ask all Albertans to take a look at the rising number of vaccines, not the vaccines, but the variants, and what the threat of the variants of concern posing to our province in the next couple of weeks if we do not take the tightening of measures that we saw earlier this week. And to understand, we have a huge amount of respect for all the businesses that are, and sympathy for the businesses that are affected by the tightening of those restrictions. But unfortunately, the vaccines only started coming to this province very recently, as I said, Bill, and it's meant that when it comes to the race between the variants and the vaccines, the variants are winning right now, and we'll thankfully get more vaccines in Q2 than we did in Q1, and that's going to allow us to provide for a better path forward for getting out of these restrictions.
Thanks, Minister. We'll take one last call, and I'm sorry, but we have to cut off at about 1:20 to get the Minister back to the House to introduce the bill we're here to talk about today. So, caller, just please be as concise as you can.
Jenny Russell, CBC.
Hi, Minister. First question about limiting the legal liability of the province in these lawsuits. Why is this necessary?
Well, it's prudent for us to make sure that the risk of taxpayers is proportional to our involvement in these cases. A lot of times, the involvement of the Crown in recovering costs is very limited. Oftentimes, it's counsel for the plaintiff who is also the counsel for the Crown, and then if the lawsuit is successful or if there's a settlement, the Crown is able to get its portion from that settlement. But it's unfair to the taxpayer for an unsuccessful lawsuit for the taxpayer to be paying a full amount. And we want to make sure that we are aligned with other jurisdictions in having the same protection for Alberta taxpayers.
Thanks. Follow-up, Jenny?
Yeah. On the bit about making discretionary the penalties that auto insurers pay for failing to file those reports, you said that it'll be in extraordinary circumstances such as a flood or a fire. What specifically will there be in the legislation, or what safeguards will there be to ensure that it's not used more broadly?
Well, that's going to be up to Treasury Board and Finance to have those conversations and make the decisions based on policy that they will be able to set. This is merely giving the discretion to Treasury Board and Finance to make those judgment calls. And I look forward to the Minister Taves and the Ministry of Treasury Board and Finance to make those decisions in the best interests of taxpayers.
Thanks, Minister. We'll have to wrap it up there and get back to the House, but thank you. And as always, feel free to follow up for responses in writing if there's anything else we can help you with. So thanks all.
Thanks, everyone.